Ans. B. 2. The renal blank is the middle layer of the kidney, and includes the renal pyramids. A cortex B medulla C calyces D capsule. Ans. B. 3. The main filter for blood in the kidney is the A hilus, B calyces, C renal pyramid, D glomerulus. Ans. D. 4. The structural and functional unit of the kidney is the A nephron, B medulla, C renal cortex, D podocyte. Ans. A. 5. The glomerular filtration rate is defined as the A percentage of filtrate that remains in the kidneys, B amount of filtrate produced by the kidneys per minute, C volume of blood that flows through the kidneys per minute, D pressure in the glomerulus that forces filtrate from the blood. Ans. B. 6. As the filtrate passes through the rest of the nephron, tubular reabsorption and tubular secretion convert it to A salt, B water, C urine, D glucose. Ans. C. 7. After the cells lining the proximal convoluted tubule remove all organic nutrients, plasma proteins, and ions from the filtrate, additional reabsorption of water and electrolytes occurs in the A glomerulus, B macula densa, C loop of Henle, D distal convoluted tubule. Ans. C. 8. When triggered by changes in the blood pressure, the juxtaglomerular cells release A renin, B aldosterone, C angiotensin I, D angiotensinogen. Ans. A. 9. Angiotensin II, A relaxes smooth muscle, B decreases sodium reabsorption, C decreases blood pressure, D is a potent vasoconstrictor. Ans. D. 10. When the solute concentration of the blood increases, A water is excreted from the body by the kidneys, B antidiuretic hormone is released into the bloodstream, C the release of angiotensin II causes the blood pressure to fall, D the distal convoluted tubule becomes less permeable to water. Ans. B. 11. Aldosterone produces all of the following physiologic effects, EXCEPT, A increased water reabsorption by the kidneys, B retention of potassium ions in the body, C increased sodium and chloride reabsorption, D decreased reabsorption of potassium ions. Ans. B. 12. Furosemide causes diuresis by A increasing circulating blood glucose, B converting angiotensin I to angiotensin II, C inhibiting sodium reabsorption in the kidneys, D inhibiting the production of antidiuretic hormone. Ans. C. 13. Diarrhea would most likely be prescribed to a patient with A congestive heart failure, B persistent hypokalemia, C a decreased cardiac output, D vasoconstriction-induced hypertension. Ans. A. 14. The micturition reflex, A produces the urge to void, B collapses the walls of the bladder, C is regulated by one of the cranial nerves, D causes relaxation of the urinary sphincter. Ans. A. 15. In contrast to the male urethra, the female urethra, A is approximately 20 cm long. B is divided into 3 regions. C consists of a prostatic urethra. D is significantly shorter in length. Ans, D. Ans, B. Ans, C. 18. Common signs and symptoms of a lower urinary tract infection include all of the following: except, a gross hematuria. B. Painful urination. C. Increased urinary frequency. D. Localized pain in the pelvis. Ans, A. 19. The pain associated with a kidney stone most often, A. is described by the patient as a dull ache. B. begins as a sharp pain in the right upper quadrant. C. radiates from the umbilicus to the pubic symphysis. D. begins in the flank region, and radiates to the groin. Ans, D. 20. A renal calculus that has become lodged in the lower ureter would likely produce all of the following signs and symptoms: except, a fever. B. Hematuria. C. Urinary urgency. D. Painful urination. Ans, A. 21. The most important therapy the paramedic can administer to a patient with an isolated renal calculus is A. Oxygen. B. Rehydration. C. Analgesia. D. An antiemetic. Ans, C. 22. A marked decrease in urine output is called anuria. B. Oliguria. C. Dysuria. D. Polyuria. Ans, B. 23. A patient with prerenal acute renal failure would most likely present with A. Confusion and hypertension. B. Joint pain and bladder distension. C. Hypotension and tachycardia. D. Peripheral edema and hematuria. Ans, C. 24. A common cause of intrarenal acute renal failure is A. Hypovolemia. B. Type 1 diabetes. C. A renal calculus. D. Myocardial infarction. Ans, B. D. 26. Acute renal failure is most accurately defined as A. Sudden decrease in filtration through the glomeruli. B. Irreversible damage to the nephrons and renal tubules. C. An acute drop in urine output to less than 750 milliliters per day. D. Sudden damage to the renal parenchyma due to sepsis. Ans, A. 27. Most cases of chronic renal failure are caused by A. Systemic diseases such as diabetes. B. Nephron deterioration due to aging. C. Frequent lower urinary tract infections. D. Nephron destruction due to medications. Ans, A. 28. Azotemia is defined as A. Electrolyte disturbances in the blood. B. An accumulation of uric acid in the blood. C. Increased nitrogenous wastes in the blood. D. Excess potassium excretion by the kidneys. Ans, C. 29. The skin of a patient with chronic renal failure is most often A. Flushed. B. Jaundiced. C. Cyanotic. D. Cool and dry. Ans, B. 30. Patients with chronic renal failure may present with uremic frost, especially A. in the urine. B. during emesis. C. to the flank area. D. around the face. Ans, D. 31. Clinical manifestations of chronic renal failure include all of the following: except, A. dehydration. B. hyperkalemia. C. hypotension. D. QT prolongation. Ons, A. 32. Definitive treatment for a patient with end-stage renal disease involves a renal dialysis, B. Diuretic therapy, C. Crystalloid fluids, D. Kidney transplant. Ons, D. 33. Initial signs or symptoms of end-stage renal disease include a bone pain, B. Remic frost, C. pruritus, D. hallucinations. Ons, A. 34. The skin of a patient with end-stage renal disease, A. is hot and dry, B. is thickened, C. may appear bruised, D. is usually flushed. Ons, C. 35. End-stage renal disease occurs when the initial signs of azotemia are present, B. the kidneys have lost all ability to function, C. urine output falls to less than 500 milliliters per day, D. the glomerular filtration rate is increased. Ons, B. 37. Unlike peritoneal dialysis, hemodialysis, A. is associated with a higher risk of peritonitis, B. filters nitrogenous waste products from the blood, C. involves the circulation of blood through a machine, D. is only used for patients experiencing acute renal failure. Ons, C. 38. A small, button-shaped device with a rubber septum that can be punctured with a dialysis needle is called a hemocyte, B. Thomas shunt, C. Scribner shunt, D. internal shunt. Ons, A. 39. An arteriovenous fistula is usually located in the A. peritoneal cavity, B. patient's groin area, C. distal lower extremity, D. forearm or upper arm. Ons, D. 40. Patients requiring chronic dialysis, A. are typically not able to ambulate, B. are usually dialyzed every 2 or 3 days, C. are almost always inpatients in a hospital, D. stay on the dialysis machine for 6 to 8 hours. Ons, B. 41. Bradycardia and hypotension following an overaggressive dialysis treatment are most indicative of a hypovolemia, B. hypokalemia, C. hyperkalemia, D. air embolism. Ons, B. C. 43. All of the following conditions may cause urinary retention, EXCEPT, a testicular torsion, B. nerve damage, C. urinary tract infections, D. benign prostatic hypertrophy. Ons, A. 44. Which of the following abdominal segments is anterior and is the most inferior? A. umbilical region, B. iliac region, C. hypochondrial region, D. hypogastric region. Ons, D. 45. The most important aspect of assessing a patient with a genitourinary emergency is to A. detect and treat life-threatening conditions, B. perform an immediate secondary assessment, C. rapidly determine the cause of the emergency, D. determine if the patient requires narcotic analgesia. Ons, A. 46. C. 47. Which of the following is a potentially life-threatening complication of missing one or more dialysis treatments? A. uremic frost, B. hyperkalemia, C. hypocalcemia, D. peripheral edema. Ans, B. Ans, B. Ans, D. Ans, C. Ans, A. Ans, A. Ans, B. Ans, B.